New Mexico has about 2/3 of its population residing in what would ordinarily be called rural areas. We only have, I believe, 7 communities that are in excess of 25,000 people. We also have a lot of mountain ranges and even communities that may be 10 miles away as the crows fly might be an hour or 2 hours away via car. So New Mexico historically ranks 49th or 50th in terms of access to oral health care. We have approximately 700, 750 dentists practicing in the state, about that many hygienists. They are concentrated in Albuquerque and Santa Fe and Las Cruces. And once you're outside of what we call the Rio Grande corridor, access to care is very, very difficult. People will drive 3, 4, 5 hours in one direction to get access to care. We see communities in which dentists retire that they may go 2, 3, 4 years before they get another dentist. No dental hygienist living in town, no dental assistant living in town, and it creates tremendous issues.
The mission of Konama Health Foundation is to be aware of and to respond to the health rights and needs of the culturally and geographically diverse people of New Mexico. So when we first learned about the Alaska model, the dental health aid therapist model, I felt that it was very closely aligned with the needs of New Mexico. In fact, Konama did a study about 3 years ago, and some of the findings from that study, number one, was that New Mexico has the greatest shortage of healthcare professionals in its rural communities of color. Another finding is that Native Americans, Hispanics, and immigrant children have suffered the greatest health disparities. Third is our uninsured rate, which includes not just health, but dental insurance. Our rate is around 22% compared to about 16% nationwide. So you can see all those factors combined would make the dental health aid therapist model very attractive to us.
The issue is that there are not healthcare providers in many of our communities, with the exception, of course, of the community health centers that we have. And we're kind of lucky in the sense that we've had about 30 or 40 years of people working collaboratively to try to get healthcare services out to rural New Mexicans.
The patient demand for dental service far exceeds our ability to meet that demand at this point in time. We could keep 2 more dentists and another dental hygienist busy probably within 5 working days. We would have those providers fully booked if we had the resources and the facilities to put them to work.
We have a tradition in New Mexico in terms of mid-level providers with our nurse practitioner models, our physician's assistants. We also have what's called promotoras, which is a Spanish word which basically means community health workers. So these are indigenous people, people that are from the community, that know the community, and are able to work in terms of the cultural side. So the model itself is not a model that is unfamiliar to New Mexicans. I think that the issue regarding the dental health aid therapist is going to be more in terms of the training, because there is no training program currently in New Mexico. In Alaska, for example, through the support of the Kellogg Foundation, they were able to work out an arrangement so that they were able to create this 2-year training program. We would not be able to send people to Alaska, so we would have to create a structure within New Mexico to provide that training opportunity. One of the options could perhaps be our community colleges, which are well established in New Mexico and reach many of our rural communities.
The other thing is that there's going to have to be some attention paid to the business side of things. It's no easy activity, for example, to get Medicaid to pay for particular services or to get a private insurer to pay for services. And so the question is, how do clinics, how do private practices, if they employ these folks, how are they going to be reimbursed for their services?
National resources tend to focus more so on medical. I think it's exemplary that we have a foundation that has a real interest in promoting and potentially developing dental care in rural areas. Dental care can be fairly expensive insofar as you've got instrumentation, technology that's different than in the medical field. It takes more than a little black bag to set up a dental practice. And it takes maintenance resources for the kind of instrumentation and tools that dental practices use.
Oral health is a very important part of overall health. So access to health care overall, I think, is going to be a more visible issue and is going to rise as one of the primary health needs in New Mexico. And our ability to move this forward in New Mexico could have major, significant impact in terms of improving the overall health of New Mexicans.